Okay, so we're moving on to what I call just the muscular system part two. Pardon me. And this is just, some uh, explanations on why muscles are named the way they are, and then a little, other types of information as well. Okay, so you understand the difference between an origin and insertion. So muscles attach to two different bones. And the origin is generally the bone, which will not move when the muscle contracts. And the insertion is the bone that's going to move when that muscle contracts. All right. So let's say, you were flexing your wrist. The muscles for flexing your wrist are in your forearm. So those muscles originate from above the elbow and somewhat just below the elbow into the wrist and into the fingers. And when they contract, they bring your hands, your palms toward, your elbow. So the origin are the muscles that are above and below the elbow, where the muscle bellies are located, and the insertion is the point where it's inserting, and attaching to your carpal bones or your metacarpal bones. Okay, we have prime movers, antagonists, and synergists. So prime movers are the muscles that provide the major force for a specific action. Antagonists are muscles that oppose or reverse a specific movement. And synergists aid the prime mover or agonist by promoting the same movement or stabilizing near joints. And so I think a good example of that is doing like a biceps curl, for biceps brachii muscle. All right, your primary mover is going to be your biceps brachii muscle in an anatomical position, the anterior aspect of your upper part of your arm, of the humerus. Right, and when that contracts, right, then you flex or bend the elbow. Right, antagonists would be the muscles that are in opposition or produce a reverse specific action. So the opposite of your biceps brachii is your triceps brachii. They extend the elbow, right, and straighten out the elbow. Right? Synergists promote the same movement or stabilize. Right? So an example of a synergist in your biceps curl, a biceps brachii contraction, would be brachialis, which is on the lateral aspect and on the medial aspect of the humerus, and the muscles, especially those around your shoulder, because your shoulder, to do a good biceps curl, you'll often say, tuck your elbows, perhaps. If you're doing a standing one, tuck your elbows to your side so that when you flex your elbow, your palms come right up to your shoulder without your elbows moving around or your shoulder moving. So you kind of stabilize the shoulder joint. So when the biceps brachii muscle contracts, the only thing that's moving is the forearm, if that makes sense. Okay. So those would be synergists that often stabilize the origin end of the bone, and keep that from moving so that you have a specific action. Okay, the naming of skeletal muscles is by location, shape, direction, size, maybe the number of origins, location of attachments, and muscle action. And we'll look at the example of each one. So this is helpful, when it's the same when you're looking at skeletal anatomy, that we gave you terms, or I gave you terms that are associated with holes through bone, like a foramen or a fissure, and then bumps on bone. And of course the holes were all passageways, something to go, from one side of the bone to another, maybe an artery or a nerve. And then you have bumps on bone, and depending on the size and the shape of them, it might be a tubercle or a trochanter, or like the linea aspera on the posterior aspect of the femur, the raised ridge of bone, or the anterior crest on the tibia. Each term is talking about a particular shape or size, maybe, of something. Well, muscles are named similarly. So when you're looking at muscles on models and things, it's helpful to look at it and go, well, why is it named the way it is? And I think that just helps you anchor it, and it makes it quicker, or a quicker process to commit these to memory. All right, so muscle, when it's by location, the muscle name indicates the bone or region, that the muscle is near. An example of that is temporalis. So I'll just tell you that when these end in ALIS, That ALIS means pertaining to, in Latin, all right? So temporalis means pertaining to the temporal bone. So this is going to be above the ears on the temporal bone. This muscle is going to travel and insert on the mandible and help you close your jaw. It's going to assist in chewing food. But when, this is just one example. If you have a temporalis, you probably have a frontalis, an occipitalis, a nasalis, a mentalis, a pectoralis, which we'll be looking at. All right, so ALS just means pertaining to the temporal bone. All right, sometimes they're named by the shape or maybe the direction of the muscle fibers. The shape depends on the arrangement of the fascicles. Deltoid is a triangular shape. So your deltoid muscle, which most people know, covers the shoulder. It originates on your clavicle and scapula and inserts on the deltoid tuberosity of your humerus. It's a triangular shape. Trapezius is a trapezoid shape. So, when you look at models, maybe in lab, one side of the model is going to be the muscles you can see when you just take the skin off. So those would be what we call the superficial muscles. To the other side is generally the muscles that if you took off the superficial muscles, these would be the ones that you see in the next layer. Because especially in the back, you have about 4 layers, depending, the location along the spine is 4 layers of muscles. Right? So you have generally a superficial side and a deep side, to keep that in mind. Well, when you're looking at trapezius, usually it's on one side, but not the other, because it's a very superficial muscle. But if you can picture them, and especially if you use your textbook, maybe, you can see both trapezius muscles there. And they're kind of looks like a kite, but that's the trapezoid shape. Serratus has a notched or toothed appearance, kind of like like a steak knife, that has the teeth to it, the notched out, surface to it for cutting through steak. That's serratus. And orbicularis or orbicular is circular or orbital kind of circular. All right, direction might be depends on the orientation of the fascicles. Rectus means straight up and down. Muscles are very parallel to the longitudinal axis of the body. So rectus abdominis, the set of abdominal muscles that are straight up and down in the middle. Or rectus femoris is going to be right to the anterior aspect of your thigh. Transverse, are muscles that are right angles or at right angles to the longitudinal axis. So if you're actually looking at abdominal muscles, we have rectus abdominis, which is straight up and down in the middle. If you can pull, and we don't make you identify this, but some places do, other places I've talked to, you can take the model apart and you can take like the chest cavity part off. And so you can see on the back side of rectus abdominis, transverse abdominis, and transverse abdominis fibers run on the horizontal. They're perpendicular at 90-degree angle to rectus abdominis. So transverse would be moving, coursing, on the horizontal from left to right. Oblique is a muscle at an angle to the longitudinal axis. You have an external oblique and an internal oblique, and they're kind of running on 45 degrees angles from rectus abdominis. Right? One is the outer layer called the external oblique, and then you have the internal oblique, which is deep to it. Now, those two muscles are actually running perpendicular to each other. So they're going to be at 90 degrees as well to one another, but not necessarily to rectus abdominis. I know that kind of sounds confusing, but when you're looking at those muscle fibers, picture them, because your abdominal muscles, you have 4 of them: rectus abdominis, transverse abdominis, external oblique, and internal oblique. And they work in opposition to one another. So rectus abdominis is in opposition to transverse abdominis. They're at right angles to one another. And your obliques are the same way, but they're just off on a 45-degree angle, where your external oblique fibers, run in opposition to your internal oblique fibers. If you get a chance to look at that, most of the time you just have to identify the muscle, and depending on the campus, you might have to know an origin or insertion, but it's mostly identification. Okay, size. Maximus means the largest. Longest means the longest. Right? Vastus means large, like we have a vastus medialis and lateralis. They're part of your quadriceps group of muscles. Lat means broad and isthmus means the most. Right? So latissimus dorsi is the most broad muscle of the superficial muscle of the back, and of the lower back. The number of origins, biceps brachii means we have 2 origins or heads to that muscle. Triceps brachii would be, tricep would be 3 heads. A quadricep would be 4 heads. And so the number of origins. And then we have the location of attachments. The muscle name indicates the origin or insertion. So sternocleidomastoid, sternocleidomastoid is named for its 2 origins and 1 insertion, the origins of the sternum and the clavicle, and then the insertion on the mastoid process. That's one of the reasons why you had to know the mastoid process. Muscle action. Well, you can, levator scapulae is named for elevating the scapula. So its origin is the transverse processes of, about 5 cervical vertebrae. And then it inserts on what's called the superior angle, of the scapula to the upper middle aspect of your scapula. So the cervical spine, when it stays stationary, you don't move your head or your neck. When this muscle contracts, it raises your shoulders up because it pulls up on the scapula. Trapezius does that too, but levator scapula, attaches to a different point on the scapula, and it elevates the scapula. Okay, so here we have a picture of head. These are a lot of the muscles that we identify, at least here on the Gibbs campus: orbicularis oculi, orbicularis oris, zygomaticus. Technically, you have a zygomaticus major and a zygomaticus minor. It means that they're originating on the zygomatic bone, and it inserts here on orbicularis oris. One is larger, one is smaller, but we can often just group it together as zygomaticus. We have masseter, I call that the pit bone muscle, because that attaches to the mandible, and when it contracts, it elevates the mandible, so you clench your mouth. It's used in chewing. That's what is very strong in pit bulls. Here's temporalis, originates on the temporal bone and inserts on the coronoid process of the mandible, so it also will elevate the mandible, when you need to chew food. We have sternocleidomastoid behind that. We have trapezius, which is the superficial muscle, to the back. And then there's you can just about see splenius here. Okay, so that just shows you some examples of how these, are named. Right? Orbicularis oris is a circular muscle of the mouth. Orbicularis oculi, circular muscle of the eye, so forth and so on. So I think it really helps if you look at them and go, okay, why are we using this name for this muscle? It's usually because something that you can observe, or visualize with that muscle. And so I think that makes it a lot easier, because otherwise, you're going to have to memorize these, and some of these are origins and insertions you have to know, but it makes it a little bit easier to understand. All right, that is it.